Many thanks for staying with us. Our coverage of the Covid-19 pandemic continues here on the broadcast, and we're now joined by the Chief Executive Officer of Nairobi Hospital, Dr. Alan Pamba, to just give his perspective on what has been going on. Thank you, Dr. for joining us.
Thank you, Ben.
The Health Cabinet Secretary today told Kenyans to expect things to get a bit dire, talking about 10,000 infections by the end of May, according to government projections. What is your take on this projection?
Look, we are fighting an enemy that we can't see. We're really fighting blind here because we don't have the luxury to be able to test everyone and pinpoint the people who are actually patients and then focus our resources on them. So under those circumstances, you plan for the worst and hope for the best. It's the prudent thing to do.
All right.
The battle is in two fronts. The first part of the battle is in the public space. It's a public health battle. And that is where we have our best chance. If we lose there, then the battle goes to the hospitals. And that will be really difficult for us because we don't have the resilience in our facilities to deal with large numbers.
All right.
So following the government directives, while we fight the public health battle of washing hands, social distancing, etc., is absolutely critical. People need to stay at home so that we don't increase our number of infections.
All right. A lot of medical experts have cited Kenya's testing capacity as a challenge in terms of giving us the correct picture of really infections in this country. Do we expect that to get any better?
Well, the government is doing its best from the conversations we're having with them to improve our testing capacity. And testing is a rate-limiting step in controlling this epidemic. The more we can test, the more we can target the enemy, the more we can know, we can focus our resources on the subjects who have infection and minimize transmission of those infections to others.
All right. We've heard a lot about Mombasa Hospital and Kenyatta National Hospital. What has been the role of the private sector in this pandemic so far?
So the private sector is, we are talking to each other, we're talking to government, and we are coordinating our response in terms of preparing to manage cases if the battle moves on to the hospital phase. At the moment, we have 50 cases that have been reported by government. And as you've seen from the projections, the numbers could be really high. So in Nairobi Hospital, for example, we are building our capacity to isolate and treat patients. We have an isolation ward, which currently is in phase 1, maximum capacity 17 beds. And we're going to take it through 3 phases to 77 beds in phase 2 and 180 beds in phase 3. Other hospitals, I'm sure, are doing similar approaches so that we can contribute towards managing this.
We've also had a discussion about the Kenya's capacity in terms of intensive care. The numbers have been thrown about. Even without giving us a number, what is the situation like?
That's why I'm saying we need to win this battle on the public health front. So some of the directives of the government are quite dire and difficult for the common mwananchi, but they have to be followed because when we get to the hospital environment, we do not, as a country, have the capacity to deal with tens or hundreds of thousands of cases if we do get to that. So it is very prudent that while we have 50 cases, we try and keep the curve flat, not get to very, very many cases. And that's really down to every single individual taking responsibility to listen to the messages and understand that whereas you may not be at a high risk of being sick from this, you could expose other people.
All right. Talk to us about what an ICU bed looks like. In your effort to build capacity at Nairobi Hospital, what are you looking at, basically?
So when I talk about 180 beds, full capacity, about 12 of those will be ICU beds. And that reflects the resources required in an ICU setup. You get into a situation where you need ventilators and much more sophisticated machinery around the patient. And this normally will be the more severe cases that end up in that situation. As we've seen with COVID in other countries, majority of patients who end up needing care in hospital will probably need an ICU type environment with ventilators to support them. And at the moment, I don't think as a country, we are ready to deal with tens of thousands or even hundreds of thousands of cases if it comes to that.
What lessons do you think we can learn from those health systems that have been dealing with this for a lot longer than us?
Well, I think where they have won on the public health front. So they have read the signals early.
By this, there are countries like Italy, France and Spain who have seemed quite overwhelmed, yet they are very advanced health systems. And we have countries like China, who seem to have gotten right very early on.
Yeah. So China has a very rapid response to these things, as we've seen. They can build hospitals in weeks. Not many countries can do that. And I think they also took this epidemic very seriously from the word go. In countries like Italy and Spain, where we're seeing very stretched healthcare systems, the message didn't sink in the population early. And even with those very mature health systems, we are seeing a strain. So you can imagine what would be, our case.
All right. So what should we be doing at this time? It is the third week. We're going to the third week of the pandemic. 50 cases reporting today. We are seeing a country like the US and the UK now quite overwhelmed. So what should we be doing on the public front now? You've told us what's happening in the private sector. What should we be doing in both fronts, public and private at this time?
The private front, I think, fairly easy. We should be preparing to manage cases when they come in, and I've described what we're doing in Nairobi Hospital. We should be building our reserves of medication and material that would be required to manage these cases. On the public front, the messages have been repeated over and over. Social distancing, washing hands regularly, staying at home. The reason for people being asked to do that is if you, Ben, had your cousin flying from Italy today, and you greeted him at the airport and he had COVID and you got infected. If none of those things was happening, imagine how many hands you'd be shaking in the course of your day. Imagine how many surfaces you touch, even as you cough and you sneeze in your hands.
Right.
So you, as a single individual, getting infected will infect hundreds of other people, who in turn will infect more hundreds of people. And the curve of infections will rise very fast. Now, with all these measures that we're being told to take, if you are washing your hands regularly, if you are staying at home, if you are keeping your distance socially with other people, then the number of people you infect will move from hundreds to probably a handful, maybe 5 or 10.
Right.
And that's how we flatten the curve. And that's what we should be doing as a country right now. Everybody participating in that process.
Okay. Speaking of which, even with the coronavirus pandemic, right, that is here with us, we still have other ailments and treatment in hospitals going on. What has been the effect of that in the face of this pandemic?
Well, so this is the challenge we have with health facilities. So we've had to make the prudent decision in Nairobi Hospital, for example, to close all our consultant clinics. So, regular diabetes clinics or clinics for what we call cold cases. So we're keeping those patients away from the hospital, and we're encouraging their consultants to do telephone consultations. We're emptying out the hospital in readiness to deal with COVID. And we're reducing traffic of visitors and so on, so that, again, the hospital does not become a nidus for infection into the society. What we've done in Nairobi Hospital, we've done a surgical incision of the hospital into 2 halves. So there's one half of the hospital which will continue to manage cases, because we still have people who will need to be in hospital for other reasons other than COVID.
Yes.
And we are expanding our COVID isolation capability on the other half of the hospital, and trying to keep a clear separation between those 2 parts, so that we continue to provide regular care on one side, even as we care for COVID patients, if and when they come in.
All right. Doctors, nurses, and other medical caregivers on the front line, against the backdrop of the challenges we're talking about, are you taking care of them?
That is my first priority as a CEO of a hospital, to take care of the frontline health workers. So first of all, I spend time with them every minute I get, encouraging them, because these are our true heroes at this moment. They're on the front line, they're facing patients who are actually infected and helping those patients recover as best as they can. We're making sure that they have personal protective equipment. We're making sure that they are morally supported. We're making sure that if they need to make movements around or stay within the hospital, we provide facility for them to stay there.
Finally, this trying to build up capacity in the private sector, it all comes down to financials. Should the government be chipping in to help the private sector?
We would hope so. I think it's a strain for the entire private sector, including hospital facilities. As I described, we made the difficult decision to close all our consultant clinics, and that's a huge revenue stream out the window. But at this point in time, human life is primal. And we're making our decisions purely based on how do we support the government's efforts to save as many lives as possible. But it is a big financial strain on us. You've had the challenge around insurance companies not coming forward to to treat COVID patients or to pay for COVID patients' treatments. All those are challenges that we need to deal with as a private sector, in supporting the effort.
Talk to us about, very quickly, the curfew that has been ongoing for 4 days now.
Right.
Has it affected you in any way?
Well, the government did have a list of exceptions, so people like myself, frontline health workers, are allowed to move around a lot more easier than the rest of the population. And that's important because we are called to different parts for different reasons at all sorts of hours. The curfew is important. Back to the message I sent earlier on, this is we're fighting an enemy in the dark, and we're fighting on two battlefronts, in the public health space and in the hospital space. We have to win in the public health space. It's too expensive if we get into the hospital space.
Thank you so much, Dr. for joining us. Pleasure having you in studio.
Thank you.
Dr. Alan Pamba, CEO of Nairobi Hospital, talking to us about the role and place of the private medical sector